Hello, everyone. My name is Shriya Veluri, and I'm a third-year student in the MD-MPH dual degree program at the UT Health San Antonio Long School of Medicine. I'm honored to have participated in the Jean A. Capello Health Advocacy Fellowship over the past year, and I'm excited for the opportunity to share a few of the projects that I've worked on during this time. Going back, my interest in medicine is deeply intertwined with my family background. As the granddaughter of farmers who have lived their lives in rural India and the daughter of immigrants who have built a life in the suburbs of Dallas, Texas, I've been exposed to a wide variety of backgrounds and environments. I spent numerous summers in my grandparents' villages, walking through farmland and dirt roads to arrive at rural hospitals such as the one shown on this slide, but I also grew up in the safe suburbs in my hometowns. These drastically different experiences have shown me the various social determinants of health and action and their role in the quality of healthcare services that people received, ultimately leading me to pursue both a medical and public health degree. However, before I began medical school, a very close family member was diagnosed with cancer after noticing a suspicious breast mass and undergoing numerous tests and imaging. Despite having access to health insurance and numerous oncology providers in my area, the diagnostic and treatment process was not only physically and emotionally taxing, but also caused a significant financial strain on my family. As a result, I grew deeply passionate about increasing access to healthcare services, specifically for under-resourced patients and communities. I immersed myself in advocacy activities throughout my first year of medical school and eventually found Doctors for America. Through the Capello Fellowship, I had the opportunity to participate in the Access to Affordable Care Committee, which focuses on ensuring that patients have access to high quality healthcare services without the threat of financial ruin. Within this committee, I was able to focus on Medicaid expansion initiatives, and I've learned from leaders in this space as they shared prior examples of strategies that have been successful in expanding Medicaid in other states, as well as current efforts to move the needle in the 10 states that have not yet expanded. Under the guidance of AAC members, I was also able to work on a comment to the CMS about the recent IRA Medicare payment reform, the Medicare Prescription Payment Plan. In response to the ongoing struggle by many seniors to afford their medications and the adverse effect of this on their health, I shared my perspective as a medical student and DFA member to showcase our stance and advocate for the full implementation of this program, increased ease of enrollment for patients, and the use of their power and budget to engage in extensive outreach, particularly by Part D insurance plans themselves. Outside of my DFA advocacy work, I focused my efforts on community outreach, leading health education sessions with Texas Wings, a nonprofit organization that offers financial and health navigation assistance to under-resourced individuals with breast cancer, as well as the Center for Refugee Services in San Antonio, a local refugee resettlement agency. I led discussions to identify what community members' biggest challenges regarding navigating their health insurance plans were, and this generally consisted of difficulty understanding what was and wasn't covered through their insurance plans. I then offered strategies to help them advocate for themselves in clinical environments as well as with their insurance companies. Moreover, through the Texas Medical Association, I wrote two resolutions during the most recent policy cycle to advocate for increased coverage for the full range of diagnostic imaging and testing for breast and colorectal cancer and for the elimination of cost-sharing measures in the screening of these common conditions. Both resolutions will be taken forward to the American Medical Association to further advocate for this issue on a national level. Most recently, I was able to attend the American College of Radiology Hill Day, during which I was able to share my thoughts regarding the physician workforce crisis and potential solutions to address this issue, as well as Medicare payment reform and the need for congressional intervention to provide stability for both providers and patients and ensure that beneficiaries retain access to high quality care. Overall, I'm grateful and empowered by the knowledge, skills, and opportunities that I've gained as a 2023-2024 DFA Capello Fellow, and I'm eager to continue implementing my skill set. Thank you so much to the DFA mentors and staff, as well as my co-fellows, for an incredible year of learning, growth, and health advocacy.